I think parents play a very important role in the treatment of their child and their recovery from the eating disorder. I think in the past there's been two misconceptions about eating disorder treatment. One misconception has to do with the role of the parent, and the other one has to do with the role of talking about food and eating in treatment. So let's talk about the role of the parents. It used to be believed that in order to recover from an eating disorder, the adolescent actually had to be separated from the parents, and this was referred to as a parentectomy. But I think what research and what clinical evidence has shown that this actually is not very helpful. In fact, it's quite hurtful to the patient and the family. I think now the philosophy of most treatment programs, and certainly the philosophy here at Children's Hospital, is that the parents play a very important role in treatment. They know their child best and they love their child best. So we make every effort to have the parents involved in all aspects of the recovery and treatment here at Children's Hospital. Secondly, I think there's some misconception about the role of talking about food and eating in treatment. I think there's some clinicians who might believe that you shouldn't be talking about food and eating because this is just going to lead to unhelpful power control struggles. I think this sort of is based on the assumption that if you can just solve the underlying cause or solve the underlying emotional problems, well then the eating will sort of resolve on its own without having to address that. I think this is also a false assumption. I think that most people now understand that really helping the child to relearn how to eat normally and to regain the weight that they've lost is absolutely critical to treatment. When somebody is in a state of starvation, their brain is not functioning properly. You can't do effective therapy when the brain is starving and the person's not able to think clearly. So you can do as much psychotherapy as you want with a starving brain. It's probably not going to be very effective. That's not to say that there should be no psychotherapy when somebody's underweight. There can still be a helpful role for psychotherapy, but clearly I think the first priority is to regain and restore physical health, which means weight restoration. And I think this is a key point that I think both families and patients need to understand, is that physical recovery precedes psychological recovery. As long as somebody is in a state of starvation, they're not going to be able to fully recover from an eating disorder. Eating disorder thoughts and feelings don't go away unless a person is able to achieve a healthy weight. So putting these two concepts together, it's very important that parents are involved in treatment and that the treatment then focuses on helping the child to restore their physical health and their weight. And one of the forms of therapy that's probably most empirically supported by research is something called family-based therapy or Maudsley family therapy. And what this therapy does is it helps empower parents to really take charge of their kids' eating, to be in charge of getting their child to retrain their body and their mind to eat regularly every day. And the way family-based therapy looks at an eating disorder symptoms is that if a child is not able to eat, they're really out of control. It's the eating disorder that's in control here, and that it requires somebody else to take charge of the eating. And that's the parent's role. And so the treatment of family-based therapy is really helping the parents learn how to support their child to eat the food that they need to recover from their eating disorder.